if you look at the recent PYQs, you can observe that examiners are asking more clinical questions and also related to drugs, even in dermatology. So that is the reason why I'm making this video. Watch this till the end to know all the important side effects of the anti-leprosy medications. Hello dear students, myself Dr. Maddineni Srinivas. Welcome to Crack Derma DrMSD. So the first medication which all of you should know, and it was recently also asked, it is clofazimine. Remember students, it is actually a dye and it is used in leprosy patients. It can produce intestinal obstruction because of the deposition of the crystalline clofazimine in the lumen of the patients who are using them. And also remember, not only in the intestine, but it can also get deposited in the skin, which can produce this pigmentation of the skin, which is a very common symptom in the patients of the leprosy who are taking the medication. And in fact, this very manifestation is the reason why many of the patients actually stop their treatment, and it is very big concern. We have to counsel the patient before initiation of the treatment that it is a very common symptom. And what is the good news, that it is a reversible pigmentation. Once the treatment is stopped, the skin color will again get to normal, and this skin color is classically coppery red pigmentation, clofazimine associated pigmentation. Very important, this was asked recently, also remember this. Clofazimine can also produce the dryness of the skin. It is called as ichthyosis. Okay. And next is rifampicin. All of you know it is associated with hepatitis, and it can also produce drug eruptions. And also remember, this is also associated with discoloration of the discharges of the patient. And I hope all of you know this orange red colored discoloration of the urine, and also other secretions also can become colored, which is also a very important concern which many patients actually have. If we don't counsel, they may stop thinking that there is blood coming out from in their urine. So we should tell them beforehand. Next is Dapsone. Remember, this is associated with glucose 6-phosphate dehydrogenase deficiency, G6PD deficiency in some individuals, which can lead to one very important side effect, which is hemolytic anemia. So this was a UPSC question, remember this. It can also be associated with hepatitis, but also you should remember, after the initiation of the Dapsone, or we can say MDT, if a patient after the 5th week, if the patient is developing entire body becoming red and becoming associated with scaling, and also there are elevated liver enzymes, and there are signs of hepatitis, and there is fever, then you should think of this Dapsone syndrome, which is also called as 5th week syndrome, which is very classically seen in patients who are taking Dapsone. Okay, this is also very, very important feature which you need to remember. Next is Thalidomide. I hope all of you know Thalidomide is a teratogenic medication, and it was previously used in pregnant women for morning sickness, because of which there was this very, very dangerous phocomelia which was produced. And also remember, it is also associated with peripheral neuropathy. So these are all the important adverse effects related to the anti-leprosy medications. I hope all of you have understood this. For all of you, rifampicin is used in one regimen which is used in actinomycetoma. Can you name what is the regimen in the comment section? Second question, Dapsone is used in vesiculobullous disorders. Can you name in which vesiculobullous disorders is Dapsone used? Put your answer in the comments. Like the video if helpful, subscribe.